Hey everybody, this is Dr. Matt Joosse at Joosse Family Orthodontics. I would love to share this early treatment case with you guys because it illustrates some great points. This is a great kid, Fletcher, and Fletcher came to us because there was some concerns about the crowding in his mouth. And so you can't see the crowding from this perspective, but one of the things that I wanted to point out from his smile initially is that you can see that he has one front tooth here, a second front tooth here, and then this is the second tooth on the right side. You don't see any second tooth on the left side. In fact, it kind of looks like things just disappear. There's really nothing, no teeth up here. And so as we take a closer look, you'll be able to see a little bit about what's going on. So we have the front two teeth, and then we have the one on the right side. The one on the left side is set back and actually behind the lower canine tooth right here. We call this an anterior crossbite, and anterior crossbites are important to fix early because they can affect the growth of the jaws. See, upper teeth belong to the outside of lower teeth, and when they're to the inside of lower teeth, it can affect the growth of the jaws in a negative way because the upper jaw grows more early on and then the lower jaw grows more later on. So what you can't quite appreciate though is the traffic jam that's happening there on his left side, and I'll show that to you in just a second. One other thing I wanted to point out though has to do with the middle of the front teeth. So here's the middle of the two upper front teeth. Here's the middle of the two lower front teeth. And you couldn't quite see this when we started, but the middle of his upper front teeth are actually off to his left side relative to his nose and his forehead and his chin. And there's a reason why that's the case, and we'll show you that in just a second. But there's also something else happening here. And if you look in the back of the mouth, look all the way in the back. This is the back left. The upper back tooth is, the upper molar, I should say, is to the outside of the lower molar. And if you look on the right side, the upper molar is to the inside of the lower molar. And we call this a posterior crossbite. It's the same as what we discussed in the front right here, but it's happening in the back where the upper tooth is to the inside of the lower tooth. And when this happens, the body knows that this is not the correct bite. And so a lot of times what happens is that kids will accommodate for this tooth position being incorrect, and they'll slide their jaw to one side so that one side fits together great, in this case Fletcher's left side. In this case Fletcher's right side then does not fit together well. And so it actually looks like there's a problem on the right and everything's good on the left. And that's not really the case. The body is shifting the jaw a little bit, and that way one side can be correct and only one side incorrect. But the reality is that the upper jaw is small, and if we make the upper jaw bigger, this will go away. The reason why we really want to treat this is because as a kid habitually shifts their jaw to one side over and over and over again, they're actually going to grow their lower jaw to be longer on one side than they are on the other. So it starts out as an asymmetry just because the body's shifting the jaw over, but it actually becomes an actual asymmetry of the jaw later on because of how it affects the growth. And so this is one of the indications of why we like to treat kids early. This is also one of the reasons why we like to see kids by age 7 or 8, because usually you can identify this by age 7 or 8 because the molars in the back typically come in at age 6. So when we see this thing, we call this a functional shift, a posterior crossbite with a functional shift. It just means that to function, to actually chew, he's shifting his jaw. We want to correct these things early. And so we correct them with a palate expander where we make the upper jaw bigger. And that's one of the things that we did in Fletcher's case. So we talked about how the posterior crossbite with the functional shift is one of the reasons why we wanted to treat Fletcher at an early age. I believe he was 9 years old when we met him. But the other reason is because there was quite a traffic jam happening in the upper left-hand side of his mouth. Now let's start out and look at the upper right-hand side. So we have the permanent molar, then we have baby tooth, baby tooth, baby tooth, and then the permanent incisors. On the left side, we have the permanent molar, and then we have baby tooth, baby tooth. The adult tooth is already coming in on top of this baby tooth. And then we have another adult tooth that's trying to come in, and this adult tooth belongs in the space between this one and this one. The reason why there's a huge traffic jam here is because we actually lost one of the baby teeth early. So again, on the right side, 1, 2, 3 baby teeth. On the left side, we only have 1, 2, and the third baby tooth was lost probably 2 years ago, something like that. And as that baby tooth was lost early, the incisors, the front teeth, they start shifting over to where there's space, and then it becomes a real traffic jam. And so 2 reasons why we wanted to treat Fletcher, right? We have the posterior crossbite with the functional shift, and we have this excessive crowding due to early loss of a baby tooth. And the excessive crowding is certainly one problem, but having the middle of his front teeth shifting over to his left side can be really problematic. It's easy to fix that when you do early treatment for reasons that we don't need to get into. It's a lot harder to treat that when you get later on. And one of the reasons we know this is because his sister probably had the very same thing happen. And so we actually had to talk about removal of one of the permanent teeth to try to get her midline, get the upper front teeth centered onto her face. Well, as I mentioned, we treated Fletcher with a palate expander, and we treated him with a few braces. The braces went on the more or less the forefront teeth. And so here's the change that we got, just looking at his upper arch. And so this is 14 months later, so our treatment took just a little bit longer than a year. And when you're looking at this picture now, there's only one baby tooth left in this picture. Fletcher has been early to lose his baby teeth. And so the only baby tooth left is right here in the upper right. You'll notice that I've created some space around that tooth to make sure that we have ample space for the upper right canine tooth to come into the mouth. Everything else that you see is an adult tooth, and so you can see that we've resolved the crowding, and you'll see how we did that in just a minute. But very good treatment in terms of resolving the crowding. Here's a picture of Fletcher's front teeth from the front. And if you look at the back molars, both of them are to the outside of the lower molars, just like we want them to be. There's no more shift of his jaw to one side anymore. I have the middle of the upper two front teeth nearly in line with the middle of the two lower front teeth. And actually, in hindsight, I probably could have done a little bit better getting these closer together. But that is something that now with this amount of discrepancy, I can easily fix that in the future. And we've got a much more aesthetic smile. So you can see that his upper front teeth are centered onto his face, and you can see kind of all these front teeth, so it doesn't look like he has a couple front teeth and then everything's missing on the left side. And so really, really quite the dramatic change here, which is really cool. Here's some comparisons. Again, this shows from the front, and you can see the difference that we made with the front teeth, bringing that one tooth forward. You can see the difference that we made in the back teeth, correcting the posterior crossbite. So both anterior and posterior crossbites corrected by way of expander and a couple of braces. Here's the difference in the upper arches. Again, the lower arch was not treated at all. We did nothing with his lower teeth at all, so that's why I'm not showing it. And you can see the traffic jam that was going on here. So we had 1, 2, 3 teeth vying for the space of 2 teeth, and now you can see that we have them all in line, even with a little bit of extra space for when this baby tooth is lost and the adult tooth comes in. And then, of course, quite a difference with Fletcher's smile. So I consider this a very, very successful phase 1 treatment. We resolved crowding. We allowed all the permanent teeth to erupt and gave them space to come into the mouth. We also corrected a discrepancy that was going to affect the growth of his jaws. And just as a bonus, we gave him a better smile. So congrats, Fletcher, on a great treatment. And if you have a young one that you're unsure about, we love to see kids at age 7 or 8 because you can identify these problems at 7 and 8, and you can use growth and you can use the discrepancy between baby teeth and adult teeth to help solve these problems. So if you or somebody that you know is in need of some phase 1 treatment, let us know and we'd be happy to give you a consultation. Thanks so much for listening.